Hello, everyone. I welcome you to the Slum and Rural Health Initiative Media Training Workshop. First of all, I would like to thank the team of the Slum and Rural Health Initiative. Thank you so much for inviting me and giving me an opportunity to be a part of this. I also like to acknowledge the gentlemen of the press, the media practitioners and professionals right in this workshop. And of course, I also like to acknowledge public health experts and health practitioners that are also a part of this training and workshop. I'd like to first of all apologize for not being able to be here in person. It was due to circumstance beyond my control. I have an official engagement, and that is why I'm not able to be here in person. In any case, I'm recording this in the middle of the night because I don't want to disappoint everyone here. I want us to be able to share things and share from my heart. I'm going to be talking about how media professionals like you sitting in this room can develop and create engaging media content targeted at pregnant moms and parents and guardians of toddlers and newborns, particularly as it is related to hygiene practices. Right about now, let me share my screen and we get right down to it. And now to the slides. We're going to be talking about developing engaging media health content on hygiene practices. Developing engaging media health content on hygiene practices. Let's quickly talk about the objectives of this presentation. As media professionals, at the end of this conversation, you will understand your role in changing behavior to improve good hygiene practices for pregnant moms and nursing mothers. Next up, you will also understand the steps to behavior change. Why is this important? You will agree with me that knowledge alone about any bad behavior or harmful habit is not enough to make an individual or a person to imbibe or inculcate good habits and practices. Yes, you may know that clearing the gutter in front of your house is important, and it will of course take care of mosquito festering in your environment. But how often do we clear the gutters in front of our houses? How often do we even clear the grasses? Yes, we know, but we don't a lot of times, put that into practice. So understanding why people behave the way they behave would help you to package, to develop and create content, health content that meets your audience need, that meets them at the level they are in. At the end of this presentation also, we will also have an understanding of how to effectively engage healthcare providers. Yes, engage healthcare providers in interviews so that we can get the best from our sensitization and awareness creation about proper and good hygiene practices. And finally, we will, at the end of the day, we will have a group conversation where we determine how to generate media content to promote good hygiene practices amongst our target audience. That is pregnant moms, newborns, children, toddlers, and of course the fathers, guardians, and anyone responsible for this group of people. Let's get right down into it. A healthy pregnant mother or mom and newborn makes a happy family. We all know when a woman gets pregnant, she is at a vulnerable stage. Her hormones are running, riot. She needs to take care of herself. She's not just taking care of herself, but also the baby growing in her. And therefore, it is important for any pregnant mom or woman to properly take care of herself. And that starts with her health, of course. And this conversation about maintaining a good health hygiene is the foundation of having a healthy mother and a healthy baby. Now, according to a UNICEF 2023 data, it is recorded that there is about 190 million children in 10 African countries that are at risk of waterborne diseases. We all know that a good, portable, clean water is next to staying healthy. There is nothing you can do in the house. We cook with water, we drink water, we prepare the baby's food with water, we prepare, our meals and all of that. We clean our homes, our environment with water. And if people cannot access good, then clean, portable water of coming down with waterborne diseases. And this can lead to death when not taken care of. Which is why we have cases like cholera. We have some of the waterborne diseases are cholera, dysentery, typhoid. And if a pregnant mom or toddler comes down with this, it puts them at risk. So that it is important for access to clean water. And these are some of the conversations we should be having going forward as media professionals sitting in this room. Now, coming back to behavior change, look on the screen. What do you see? Yes, smokers are liable to die young. What else do you see? You see a man in a lab coat, a doctor, a stethoscope around his neck. Now, this doctor is supposed to be telling his patients that smoking poses a risk to their health. Smoking can cause lung cancer. Smoking can cause heart diseases. He knows that smoking is dangerous, harmful to his health. But this doctor, in spite of his knowledge, in spite of his expertise, in spite of his being a professional, still smokes. Which is something I want us to be thinking about as we talk about creating content that addresses maternal and child mortality through maintaining proper hygiene. Like I said, people do not necessarily imbibe correct behavior even though they have knowledge about a harmful behavior. People do not necessarily imbibe correct behavior even though they have knowledge about a harmful behavior. So our work as health content creators, media professionals, is to change the behavior of people who listen to our health programs. And in this instance, our purpose and goal is to change the behavior and the mindset of that woman to be intentional about taking care of herself, whether as a pregnant mom or a nursing mother, to be intentional about what she eats, to be intentional about what she drinks, to be intentional about caring for herself, bathing, basic healthy behavior, to be intentional about her environment being clean, and not just her, everyone around her on the family level, be intentional about a healthy lifestyle, a healthy environment for a pregnant mom and a newborn. Still on the conversation about steps to behavior change, you would recall the doctor who continues to smoke, maybe because of addiction, maybe because he cannot help himself, maybe because he feels that smoking is how he gets to relieve himself of stress, in spite of the fact that it poses as a health risk to him. He still smokes. So your audience will be on one of the steps in this slide you are looking at. On the last step, we have audience who are at the pre-knowledge level, the pre-knowledge stage, where they do not have any knowledge about the importance of how harmful certain behavior can be to them. For example, every time in our neighborhoods, on our streets, you see people selling food by the gutter. Food hygiene is almost zero. People sell puff buns on they put it on a tray in the open. They do not cover it. You see the flies, the smoke, the car fumes, all kinds of airborne disease are flowing all over the place, and people will stop. and buy that puff puff you are looking at. They will buy that akara that is in the open, where they will buy that fish that is in the open where there are flies, there is a gutter. They will buy and eat it. And then you hear a disease no dey keep poor man. So that is a lack of knowledge that this can actually pose a threat to them. So when you want to address those kind of audience, you want to be intentional to let them know, to show them how food exposed in such environment and in such condition in such condition can become food poison, can harm them, can make them sick. Next are the people that have knowledge about the habits, like the doctor, but are not willing to make any changes. So you are going to design a content that addresses this group of people. You want your audience to not only know that good hygiene practices will chase away, will keep away diseases and sicknesses that could be harmful to them. You want to move them to the level where they agree, approval stage, where they agree that these practices, not clearing your gutter, not sweeping your house, not drinking clean water, not boiling your water, eating food by the roadside, not being intentional about yourself, can bring disease. You want them to agree that this is so. And not just agreeing that this is harmful, you want them to have the intention to actually practice this behavior. And then not just having intention. You know how you say, oh, I plan on doing this task tomorrow, and then you postpone it to next tomorrow, and tomorrow never finishes. It's the same thing with habits, healthy habits. People keep postponing and tomorrow never finishes. Next, you want to ensure that they practice. And when someone gets to practice and discover that practicing this right behavior makes them healthier, they become advocate and say, the other day I went to buy, puff puff on the roadside though, and when I bought it, I purged. I almost, in fact, I almost fainted. They have to rush me to the hospital. You find that person telling other people that be careful, don't go buying food at the roadside. So we need to be thinking around these things and look at how we can create specific content that will address our audience at their level. Now, let's get down to the nitty-gritty. How do we then create interesting health content? Some of us already have knowledge about this, but specific to our target audience, that is pregnant moms, nursing mothers, toddlers, and children. So if you want to create a health content that addresses hygiene, good hygiene practices among pregnant moms, nursing mothers, and you're not talking to them, you don't know the barriers, the things that prevent a pregnant mother from, practicing behaviors that makes her healthy, her and her baby healthy, that helps her, you don't know the things that hinder her from taking actions that will help her to be more healthy, that will help her baby to be more healthy. You don't know the barriers to, eating good, healthy, and balanced diet. So you will need to talk to pregnant mothers. You need to talk to nursing mothers. You need to go to where they are, where you can find them. That could be in your neighborhood. That could be in family members. That could be in, at primary healthcare centers or antenatal sessions, immunization sessions. And then next, you need to work with the public health experts, community health experts, doctors, nurses who work with pregnant women, nursing mothers, because they'll be able to share experience and they'll be able to provide the correct information that people trust. People trust doctors, they trust nurses when it comes to their health. So you want to bring a resource person that your audience trusts. So even when they don't want to practice a certain behavior, when they hear a doctor saying it, or a nurse saying it, or their health expert saying it, they say, doctor Sokwe, the doctor said, the nurse said, and they are likely to take it more seriously. Still talking about creating interesting health content. You want to package, what are the formats that we should adopt? You have engaged the nursing mothers, the pregnant moms, you have engaged the health experts. So you want to create content that are digestible and easy to understand in formats, capsules that are endearing to your audience. So these are ideas that you can run with. Have pregnant moms discuss how they maintain good hygiene practices. Record such pregnant moms and bring them on your show or your program. Have a pregnant mom tell her story. Storytelling, when people hear people like them, they are likely to believe what you are saying. They they are likely to say, oh, if so and so person, pregnant woman is doing it, if so and so pregnant woman said by doing this, she saved herself and her baby, then I am pregnant, I should also, do it. I give you an example. Very recently, I was on a radio program and I was talking about my experience, my journey, with over fighting against fibroid and winning the war against fibroid in my life. And one elderly woman calls into the program and says, oh, my daughter is pregnant and she also has this thing that you people are talking about on radio. We are afraid that she may lose her baby. And I told her that no, there is no cause for alarm. I told her that I had all my children, still having fibroids. I was properly managed by my medical doctors, my nurses, my healthcare providers. And I encourage them that they should ensure that she registers for antenatal and ensure that she goes for all her clinics and follow up with all the monitoring that her doctors, her public care providers, her healthcare providers, might be giving to her. So that woman and her pregnant daughter, their fears are allayed because they heard my own story that I was able to get pregnant with my fibroids and my doctors managed me well and I had my babies and my children. So stories, other people's stories are powerful ways of convincing people to change behavior or imbibe a behavior. Look for relatable music for pregnant mothers, particularly the ones they sing at antenatal sessions. Look for relatable music. This is very important. Talk to other people, conduct short interviews, and also engage the use of drama skits. Now, talking about interviewing health professionals, how do we make it count? Not just to come and talk about what is hygiene, who is a pregnant woman, just go, just talk generally about the professional point of view. You as a media professional, you need to read up. You need to have proper knowledge about the health area. In this case, hygiene as it relates to pregnant moms, nursing mothers, and toddlers. And then, of course, invite the right expert suitable for your topic. Ensure that he or she is a good communicator and understands the language of broadcast. So if your program is in English or Yoruba, you need to be sure that the health professional that is coming on board, that you are featuring on your program, has the knowledge base of this language. Draw up appropriate questions. Share these questions with your expert that is coming so that he or she can adequately prepare ahead. This is not about sharing all of the questions, but they need to understand the point of view that your conversation, the interview, will be focusing on. And so you need to share this with them so that he or she can prepare and come prepared with correct, updated health information, for that specific program. Remember also the health experts can provide insights based on experience and what they do, handling these pregnant women, nursing mothers, and babies as it regards to health, wellness, and hygiene. And now we come to the tipping point. Having said all of this, what is the expectation? What is expected of us? The conversation is not just to have this conversation for conversation's sake. We are all in this room to collaborate with the Slum and Rural Health Initiative team to save the lives of pregnant moms, newborns, and the unborn babies as well, through creating and developing health content strategically focused on good hygiene practices for this target group. So we're going to be looking at creating program content. If you have health programs, we would love to collaborate with you to feature some of the experts on the project of the Slum and Rural Health Initiative team, to feature on your program, to feature on your news and special reports, to feature on your commentaries. They will bring their expertise to help you do justice. You can also, of course, as newspaper, if you are from the print perspective, you write articles and reports that cater to the needs of pregnant moms and nursing mothers to prevent maternal and mortality rates through good, proper hygiene practices. And of course, also, we will also need you to provide coverage to support better Mama Pikin community engagement activities, as it were. At this point, we're going to go into our group work. A colleague will be coming up to take this session. And at this point, we'd like us to discuss topics we can all talk about based on all you've been hearing from the beginning of this training and workshop. You've listened to talks on nutrition. You've listened to the goals and objectives of the Slum and Rural Health Initiative team. You've listened to all about maternal and child health as it relates to hygiene, good hygiene practices. Now, at this point, I want us to put heads together to develop topics, to create spaces on your programs where you can eventually take forward what we are talking about. Remember, if we do not act upon what we've talked about, then we have only talked and nothing will change. And remember, we are saving lives here. A mother and a child that is saved is as good as the whole family being saved, is as good as the whole society being saved. At this point, I would like to take a bow. I hope you've been able to take out a thing or two from my presentation that will be helpful in creating more impactful, more impactful health programming, content, stories, reports, and article. I hand you over now to my colleague. My name again is Adebisi Adetunji.